Well, good afternoon to everybody. My name is Derek Spencer. I'm the director of the JOCS Initiative at the Institute of Human Virology, University of Maryland School of Medicine, and we are just so pleased that you are here and appreciative of your time. Before I go any further, I just want to acknowledge some of the leadership of the Institute. Dr. Gallo had to step out. He is the co-discoverer of HIV being the cause of AIDS and developer of the HIV test, and he's having a meeting with some developers for a vaccine for HIV. So he stepped out. I have Dr. William Blattner here, who, thank you, Dr. Blattner, who's Associate Director of the IHV. We also have Dr. Robert Redfield, who might want to just move his hand, who's the Director of Clinical Care and Research and also Chief of Infectious Disease here at the School of Medicine. For just the next couple of moments, I want to talk to you from a simple theme, the responsibility of greatness. Can I tell you I'm challenged because my glasses were broken? And so on my way over, I had to print what I wanted to say to you with large font. So you can make funny faces. It does not matter because I cannot see you, but I can feel you. I want to talk about the responsibility of greatness. Recently, I was honored for my work in the field of HIV at an elite nightclub in Baltimore. And it was comical. I have three daughters, 21, 18, and 16. And so the big discussion was what I was supposed to wear and what I was not supposed to wear, because it was all about me not embarrassing them. To receive this award, I stood in the middle of a dance floor before a host of beautiful young people all gathered to acknowledge World AIDS Day and the impact of HIV in our community. I can tell you that I was awestruck. All around me, very similar to today, I saw the image of greatness. On this night, I experienced the gifts of rap artists. I don't even do rap, guys, but I enjoyed rap that night. Spoken word poets and comedians. I experienced the hospitality and the excellence of the organizers of the event, and I was filled with an overwhelming sense of pride. In that moment, I felt that I was not just the father of two of my daughters who joined me, but I was the dad of all of these 50 young people who were looking at me. Today, I'd like to share with you just a piece of that passion. In the state of Maryland, in 2010, data would show with estimated AIDS diagnoses ranks Maryland at number 2 in the United States in this particular look at this data. So you're seeing the District of Columbia that has a known prevalence of HIV that's somewhere around 3%, upwards to 5%. We're over the age of 20 in many spots in D.C., 1 out of 20 people living with HIV, and you see that we are very close to that. We also see data here when we look at the Baltimore-Washington metropolitan area that we are number 4 in the United States. Related to specifically what you see there, these issues of AIDS report cases. And I want to say to this group that it's not nice that you are here. It's necessary that you are here. As an emerging professional being trained in this great state, your interaction with the crisis of HIV and AIDS is in fact inevitable. We're in crisis and we must respond. Silence filled the nightclub in a similar fashion as it has filled this room. And I began to affirm their greatness. And with as much eye contact as you can make with 50 to 75 young people, I told them that they were beautiful, I told them that they were immensely talented, and I told them that they were full of promise. I asked them, and I ask you, which one of you thinks that you are just average? No one in that room raised their hand. They look intensely at this stranger who reminds each of them that there's responsibility associated with being great. That greatness must be partnered or married to responsibility and discipline to foster its most positive, sustainable influence. Our great university, comprised by nationally recognized faculty, researchers, facilities, and students, coupled with the University of Maryland medical system, educate and train over half of Maryland's medical professionals. We have an opportunity and a responsibility to address the major issues that confront this state and beyond. We are in a moment, and every moment requires a movement. For the first time in my career, I am hearing goals of getting to zero new infections, zero death, zero discrimination. Treatment has advanced, and we can offer newly diagnosed clients treatment options with as few pill burden as low as 1 pill a day. The medicines have fewer short-term side effects, decreased long-term toxicities, and we know that early treatment is not just good for the individual, but it's good for the community. The client tested and engaged in care, as Dr. Redfield said in that video, not only has decreased morbidity or illness and mortality death, but that client is less likely to transmit infection to an unprotected partner. We are learning that what is good for the patient is good for the community. When I do well for the patient in front of me, I do well for Baltimore. Some of you are not understanding how this applies to you, perhaps as a social worker, as a dentist, or even as a lawyer. The psychosocial issues that surround HIV are far. And so when we, as emerging professionals at this university, are equipped to deal with the HIV crisis based on our discipline, based on what we do best, when we bring our gifts to the table, when we do well for advocacy, when we do well for housing, when we do well for poverty, when we do well for dentistry with the client in front of us, we not only treat the client, but we treat our city. We are hopeful, but that hope comes with responsibility. And so while we must continue to focus on the devastation of HIV, we must begin to shift our conversation to the possibilities of an AIDS-free generation. To the students gathered in this room, we believe that you are great. Do you believe that? You don't sound like it. I can remember being in school and not feeling so great. I was just trying to get through. But I can tell you this, I got my bachelor's and my master's here. But we believe that you are great. I had no idea, running out of the School of Nursing, home, trying to get care plans done, and rushing back just in the nick of time to get that assignment in, that one day I would have the opportunity to do something so important in this city. I'm very proud of my training here at the University of Maryland. And I do want to say to the students here today, I wish you something far greater than success. And I know you want to be successful, and I know you want the big job, and I know you want the title. But I wish you something far greater than success. I wish you significance. I wish that whatever you are called to do, whatever your gift is, whatever you've been trained to do, that you would be significant and the world will be different because of who you are. In 2010, the Obama administration released the country's first national HIV and AIDS strategy. And our next speaker will review the components of the strategy with you. There's a handout in your packet. I'm going to ask you to take notes. I'm going to ask you to listen attentively because you're going to use this national HIV and AIDS strategy throughout the remainder of the day with your workshops. In June 2011, I approached Heather Hawk, and actually I approached Angela Waguea, who was working there at the time. but I approached the Maryland's Infectious Disease and Environmental Health Administration with a bright idea for a program called Preparing the Future. She believed it was relevant, innovative, and a strategic match to fulfill some of our state's objectives. And I'm so happy, Heather, that you're here today. I want to embarrass you and thank you for your support. We sometimes move very fast at the JOCS Initiative. We had an idea and we made phone calls. We got a grant rolling just in about 10 days. And so we're really, really happy for what has evolved. We could not imagine the transformation in our students. This has been far greater than teaching people how to HIV test. You saw the video. We are seeing people be transformed, and I would want to be the client of any of those students that you saw in that video. They are building empathy and knowing how to engage with the community, and we think that it's awesome.